Hello, my name is Deja Ruffin, and this is my discussion board response. First, on my informed consent form that I found online, the counselor states their credentials, which is a MA in clinical mental health counseling, and they are pursuing an LPC in Virginia. However, they are doing a residency under Milgram and Associates. She listed her supervisor's credentials and their contact information, which is ethical. Then she goes on to talk about their theoretical approaches and how her approaches are holistic and integrative theories that address the mind and the body. Super vague. One of the critiques that I made was that she should have identified in depth which approaches she was going to use, such as a cognitive behavioral therapy, family therapy, psychodynamic therapy, just to give the client a better idea of the counseling style that she has. She also talks about doing mind and body techniques without actually identifying which techniques she would be using. However, she does state the client's what the client's expected counseling service will consist of, such as providing psycho-educational resources for the clients, and instruction, practical skills, and manageable short-term goals for the client to reach in order for them to get to their treatment and desired goals. And then the counselor goes on to talk about the benefits and risk. They express the risk of the counseling service may be mentally distressful during the counseling sessions. However, talks about the benefits long-term for the client when receiving these counseling services. And then goes on to state that there are no guarantees of outcome, which is ethical because you're not promising that the client will get the best out of our counseling services that they might have in mind. And then they go on to talk about confidentiality, and I wanted to touch on this a little bit about their limitations with confidentiality, because it correlates with ethical principles. So one of the limitations that she touched on was the mandatory responsibility of reporting when a client has disclosed that they are thinking about or wanting to harm themselves or another person. It is one of our principles as non-maleficence, which is according to Daniel textbook found on page 13. It is directive to do no harm to those who put their trust in our abilities. Non-maleficence requires that I am responsible to act with competence and in the best interest of my clients. And if our client is reporting that they want to harm themselves or others, it is within our best interest to take care of the client and report those instances. She also talks about multiple relationships and the limited interactions with the clients outside of a professional setting, internet and social media, and friending clients, emergency contacts, HIPAA privacy notifications, cancellations, missed appointment fees, counseling fees, and also implements the intake biographical data at the end of the form. One of the things that she did not talk about that I felt was ethical to talk about was the insurance policy, the procedure of ending the client and counselor relationship. She did not go into detail about how to do that for the client. They didn't talk about the disputes or complaints that the client may try to take, and did not mention any tests or did not talk about the arrangements of procedures in the event of a vacation, sickness, or excuse cancellations.